My name is Jason Schroyer. I'm an EMT here in Hampton County. I work for Hampton County EMS, and I'm also a volunteer firefighter with the Hampton Fire Department and Fairfax Fire Department. August 16th will be a year for me since I had my surgery from the back disease that I had, Scheuermann's kyphosis disease. Dr. Sachs down in MUSC did an outstanding job.
When I first saw Jason, he came to me because he was having a lot of back pain, and he had a problem with his back bending. He was really what we call kyphotic, where he was sort of a little hunchback. He was one of two twins, and his twin brother didn't have back pain and didn't have the hunch that Jason did. Jason had been to a number of different people asking for relief of his pain and what could be done, and unfortunately was given information that there wasn't anything that really could be offered him.
Before I had my surgery, I was able to do some of the stuff that I could do now, but it was becoming very hard for me to fight fire, run calls on EMS. I got to the point where I was unable to do any of it. In July, the beginning of August of last year, I had to come off the ambulance and off the fire truck. I wasn't able to help people like I wanted to.
Because he was a young man, and he's very active in life, what I talked to him about and what we agreed upon was a surgery that would be done minimally invasively through percutaneous small poke holes, sticks, through his chest, since we were working through the chest cavity to get to the thoracic spine. The easier way, and certainly the more humanitarian way, the nicer way for him, was to do it through small poke holes rather than a big, large incision. And we would save him having to spread his ribs apart. We wouldn't create as much scar tissue. We would move the lung and the heart out of the way and be able to get to the spine through 4 small poke holes about the size of each of my fingers, spaced on the side of his body. And aside from having very little scar, it would be under his arm, and it would be much less painful and easier for him to recover. It really takes a good team to do it, first of all, a team that's trained and that's competent. It takes a lot of technology, some expensive technology, which we happen to have here at the medical center. It takes a specialized recovery unit, an intensive care unit that's capable of recovering. And it takes people, for the most part, who are trained and very proficient in being able to do this procedure and do it quickly so that the patient gets in and out of surgery in a very safe manner. Everything that we had planned as far as correcting a spine and lining it up worked well, and he bounced back really from a major surgical procedure on a spine and bounced back as if it was, well, I wouldn't say a day in the park, but a more minimally invasive procedure, more like dental surgery or something like that.
It changed my life. I'm able to run calls on the ambulance, on the fire truck, help other people, and save other people that I used to could do, and able to do it again. Back to work on Thanksgiving Day. I really do be thankful.